So welcome to the Talking Healthcare podcast series by MedDigital and the Self-Care Forum. I'm your host, Dr. Felix Jackson, founder and medical director of MedDigital and MedCrowd. And in this episode, I'm pleased to welcome Phil Moore, who's a GP in Southwest London, and who's going to be talking to us about a highly commended initiative during the 2020 Coronavirus Innovation Awards. So Phil, would you like to just tell us a little bit more about yourself?
Hi, Felix. I'm a GP. I've been a GP for many years, and I work in Southwest London in the borough of Kingston on Thames. And I've been there for many years. And over lockdown, we began to be a bit concerned that a lot of our chronic disease patients weren't getting followed up properly. So we found a way of trying to encourage them with their self-care.
So that's really interesting. So how did you do that? Tell us more about your initiative and what you actually did.
Some years before, I'd come across an organization called The Sound Doctor, who were ex-BBC employees, I gather, who created videos for self-care that were bite-sized. They were typical YouTube videos, 3 to 5 minutes, that built up into a lot of information about a variety of conditions. And when I saw this, it seemed to me like an extremely good idea, an extremely sensible way to approach things, so that we could begin to get out to people. And the advantages of having this form of interaction is that we could do it at scale, and we could target it at particular people who needed these. And because they were short video styles, they could be used at a time and place that suited individuals rather than trying to get them to come to a course or a class.
Yeah, that makes a lot of sense. And it's interesting how video has become such an important medium for people to find out about topics and also find out information, all the how-to videos that are available online, etc.
Well, I think you and I would agree that if we go on the internet to find out anything now, you don't tend to read a great blurb. You tend to watch the videos and follow those. And they're the way we get the information.
Absolutely. I was just fixing my bike the other day and using a video to show me how to do that. So I
absolutely
totally understand. But what about your videos? What topics were you choosing, and how did you select those topics?
Well, the topics were selected largely because of these other topics that they had available, and they've got a whole series of topics around diabetes and around new diagnosis of diabetes, around COPD, heart failure, back pain, dementia. They've got other ones about workplace health, about weight management, about frail elderly, and about generally keeping ourselves in good nick mentally and physically. And they're building those video sets all the time.
And who are those videos aimed at? Who are the people you're hoping would be watching these?
Essentially, we are looking at targeting those with the conditions, if it's for a condition. So we'd look up all the people with diabetes, and we'd make a list of those, and then we would text them with information about links to these videos so that they could watch them at their own pace and in their own time. Alternatively, if it was around general health, we would target all of our adult population. We would also be considering that carers would be other people who would watch these videos, because if you've got a relative with a particular condition, you may well want to watch that with them or separately from them so that you understood more about how to care for them.
That sounds really interesting, how you've identified the people who really needed that support. And as regards the actual videos themselves, how did you make sure that the content in them was understandable and really communicated what you needed to tell these people?
I can't profess to have watched about 400 videos, Felix. However, the people who are producing these, all of these are clinically vetted, clinically designed. It's got clinicians who are on them producing the information. They are peer reviewed by a variety of people, and we get feedback from those who are using them, and they've been used in a lot of areas. So we were confident, and obviously we dipped in and watched a number so that we could be confident, but we were confident because of those other factors that we were asking people to watch things that were sound, that were based on evidence, and were going to communicate to them in an effective way.
Yeah, that sounds like you've got a big team of people there helping you make sure that the content is as good as it needs to be.
Yeah, indeed. And obviously, I, as the GP, wasn't involved in the actual making of them. It's a firm that are making them, but we were just actually making use of them to help our population.
Yeah, that's very interesting. And where were the videos actually hosted? Where did you put them online?
Well, they're hosted by the Sound Doctor, and what we did was we had practice-specific links for the different conditions, so that when people clicked on that link, we could say how many from each practice had access to the particular video on that condition. So we could look at the figures over the period of time to see how many were getting into those.
Brilliant. So you could actually track progress and see,
Yeah,
how people are using it and how they
that's
were
right.
engaging with it. So you
Yeah.
knew that it was working.
What we couldn't do is identify individuals who had watched the videos, except for the diabetes new diagnosis one, which is the initial learning about diabetes course, where people had to register so we could actually identify the specific people, which is quite important for some of the statistics that have to be provided nationally for that particular course.
So then you needed to know individuals, but normally you were just looking at kind of general trends and
That's right.
aggregate data.
Yeah. So through the lockdown, we simply used texting to get to people, and we did it several times over to encourage people to watch them. And we had several thousand people who watched these videos over the time. Now we're looking at dealing with this in a slightly different way because all the practices are extremely busy and overloaded. So what we're doing is we're trying to avoid giving the practice managers the work of having to text people again, and we're looking at hosting the videos on something which is called Connected Kingston, which is a joint project that is trying to bring together all of the community services within the borough into one place. And so what we're looking at is having links hosted on that website so that not only GPs, but community services, consultants, social workers, carers can all signpost people to that one website where they can get the links to the videos to watch them in a different way.
Yeah, that sounds like a very interesting initiative to kind of combine your forces across Kingston to make sure that you've got a really connected approach across community care.
That's right.
And so, what was the overall impact? I mean, you mentioned that thousands of people have watched these videos, but what was the overall impact of this initiative?
Right. I think the impact is that we had, I think it was eventually something like 9,000 views, which is really fairly good when you consider the kind of contact that you get with people who have to attend courses and so on. But it was done in a period of time where we were in lockdown, where people weren't getting the normal access to care and long term condition follow up that they would normally get. And so you have to say that in a period of lockdown, when things really were very different to normal, we had something like 9,000 views of videos about self care for a variety of conditions that we wouldn't have had otherwise.
That's amazing numbers of people and amazing numbers of views there. So that's a huge number. So very impressive. And if you had somebody else who's running something similar to this, what advice would you give them to help them get started and getting these videos out there?
That's good, very good question, Felix. One of the key things is we have to remember that primary care, general practice, is very, very busy at the moment. And what we did was we worked very hard to give the practices a minimum amount of work to do in order to make these known. So we did all of the designing and writing of the texts. We told them exactly how to get the lists of people downloaded so they could then mass text them all. We explained all of that to them. It was all prepared so that they had little work to do. And that's one of the reasons we're now moving on to a central website, is because the practices at the moment, I think, would simply say, cool, this is just too much to send out another load of texts. So we're doing it a different way. So one of the key things is to minimize the work for the practices in getting contact with their patients to get into these self-care videos, because that is the surest way of getting the cooperation.
Yeah, that sounds like very, very good advice there. And I'm sure that that will really help people get this going and get the right people viewing the right videos.
Indeed. The good thing about this particular project was it didn't mass target people with things that weren't relevant to them. It targeted people with a specific condition with a specific video about that condition, or a series of videos about that condition. So they didn't have to wade through junk texts that weren't relevant to them. All the texts were exactly relevant to them. And I think that's another important aspect.
Yeah, so the content was specific for those people and tailored to what they needed to see.
Correct.
And do you have any other tips about, how people can improve these initiatives, how they can create these kind of informative videos for their patients?
Well, the videos are created by the Sound Doctor. There are other people who do similar things, but this is a set that are being created by them, and they are constantly expanding the range of videos that they are doing. And what they're prepared to do is to listen to what people feed back, to inform what they're going to do next. And they will even do bespoke things, but obviously there's a cost to that. If you wanted a particular bespoke set of videos, then they can actually cooperate with that, but you'd need to pay for it.
Yeah, that's very interesting. So, Phil, one thing that'd be interesting to find out is how's this funded? I mean, who's paying the bill for these videos to be created, and also the work to get them out to patients in the community?
Thanks, Felix. It wasn't easy. It took me 2 or 3 years to get the first lot through. And what I managed to do is our CCG at the time had some charitable funds, and I managed to get the charitable funds to fund the first year of those videos as proof of concept. Having used it for a year with the results we had, I then managed to persuade our borough, because the CCG had changed to a larger area, but our borough managed to find enough money to fund it for a second year. And we're trying to work with the larger CCG at a much wider footprint to say, can we fund them for the whole area? That's still up in the air yet, but that's the way that we've done it to date.
Fantastic. That's really interesting that you had to start with the charitable funding, but that proved the concept. And then that's moved on to be a much bigger funding stream, which hopefully will keep it secure for the future
Yeah.
so that this can be an initiative you can invest in and grow and really help patients.
And hopefully our proof of concept will be useful for other people so that they can find a different route to get the funding.
Yes, exactly. Yeah, you're showing a good route in to get something started. And do you think this is going to continue after the coronavirus pandemic passes, hopefully this year? Do you think this initiative will continue and still be part of the care that's given?
100% yes. I mean, let's face it. Through the pandemic, we've all got used to using virtual communications even more than we already had. And these videos, I think, are bite-sized, easy to access. You can do it any time of the day or night. You can do it on your way to work, on your way home, at night, wherever you want to, you can access these. And that is a huge benefit of them. But the other way they can be used is they can be used as videos to lead a group that want to get together for self-help. Then they can be used, the videos, to promote the understanding and engender the discussions that help them to support one another. So there's a variety of ways that you can make use of these things. They can also be used in group consultations, which are beginning to come in increasingly in general practice, or at least they were before the lockdown started. And they're very useful in those kind of contexts. You can also give people a link to videos at their long-term condition follow-up, or consultants can give a link when they're seeing them in hospital. Community matrons who go and see people at home can suggest a link to the videos. All kinds of ways that they can be used. So I have absolutely no doubt that we will continue to use this kind of virtual communication to enhance and promote self-care throughout the whole borough.
So that's very interesting because you're saying that this isn't just an online thing. These are going to be supporting this wide variety of kind of healthcare stakeholders from community right up into specialist care, but importantly, supporting their face-to-face activities. So when they're in a meeting, in a consultation with a patient, seeing them face-to-face, they will be showing these videos to support the kind of education and support with that patient.
They could certainly show the videos because they're quite short. However, what they may well do is actually emphasize a link to the videos so that the patient can go away and watch the whole series of them in their own time. So yes, a whole variety of ways they can be used.
Yeah, that's very interesting. So, well, Phil, thank you very much for coming to us to talk about this very interesting initiative. And it's a pleasure to hear about it and the fantastic benefits that you've
Yeah.
provided to so many patients over the last year and even into the future. and how the patients will benefit from this
Yeah.
fantastic videos and the content that you're showing to them. Thank you
I'm
very much.
delighted to talk to you as well, Felix. And if people want any advice or further information, I'm always happy for people to make contact with me.